Hello, anatomy students. We're ready now to talk about our final topic on our discussion on the cardiovascular system. Today we're going to focus in on blood pressure. So we're going to talk about what those two numbers mean. We'll talk a little bit about some factors that affect blood pressure and some things you can do to try to maintain a normal blood pressure. When you talk about blood pressure, you always typically have two numbers, and so what exactly do those numbers mean? So remember, as we talked about, your heart is essentially a gigantic muscle. And so its function is to pump blood through the rest of your body. And the way that it does this is through pressure. And so remember that pressure is a unit of force over an area. And so typically, if we look at a graph looking at the pulse pressure, on the vertical axis here, we have pressure, and in this case, it's being measured in millimeters of mercury. And so if you remember from chemistry, when we're talking about the states of matter, you will remember that pressure is measured in multiple units, such as atmospheres and PSI, and millimeters of mercury is one of the ways that it's measured. Typically speaking, your blood pressure, the systolic, should be 120, and the diastolic should be 80. So those are both pressure readings. And so the systolic pressure, the top number, is the maximum pressure that occurs during ventricular contraction. So when your heart is pushing at its strongest in order to get the blood that's been oxygenated to the rest of your body, this is the highest pressure, and so typically you want this to be around 120. The diastolic pressure is the lowest pressure that remains in the arteries before the next ventricular contraction. So again, if you remember back before, you have the ventricular contraction while the atrial relaxes, and then it switches it up. And so remember that again refers to the systole and the diastole. And so the systolic pressure is the top number, and the diastolic pressure is the bottom number. And so typically you want to try to have 120 over 80. And so that hopefully explains that. So if your systolic gets to much greater than 120, you might have hypertension, which is a condition that is resultant of many different factors, one of which might be stress. And hopefully you guys aren't stressing out too much over this topic. There are 4 major factors that affect arterial blood pressure, and so one of these factors is blood volume, and so blood volume is determined by both fluid intake and fluid loss. The fluid loss may be just passively done, or it can be regulated by the kidney. So once again, we see that even though we're talking about the cardiovascular system, we can see that the urinary system, otherwise known as the excretory system, is also important for the regulation of your mean arterial blood pressure. So again, all the body systems of your body communicate, they talk amongst themselves in order to help you maintain homeostasis. All right, another factor that impacts blood pressure is going to be the effectiveness of the heart as a pump, and so this is determined by both heart rate and stroke volume. A third factor is going to be the resistance of the system to blood flow. This is determined basically by the diameter of the arterioles. And so basically, the smaller the diameter, the more resistance it's going to face. And so basically, it's like trying to push something through a very narrow passageway as opposed to something where there's a larger passageway. Finally, relative distribution of blood between arterial and venous blood vessels can also impact blood pressure, and this is determined then by the diameter of the veins. And so we see that 2 of these blood vessels that we talked about yesterday would, as you expect, impact how blood pressure is regulated. And so those, again, are the 4 different factors that affect blood pressure. All right. You guys probably don't have to worry about this right now, but older people always have to be careful about keeping their blood pressure at a normal level. So again, that 120/80. I mentioned before a condition called hypertension. And so hypertension comes in two different varieties. We have essential hypertension. This is due to people who are either overweight or considered obese. We can also have edema, which is an inflammation of the lower extremities. We also have secondary hypertension. Secondary hypertension is caused by diabetes. And so remember, diabetes is a condition where your pancreas does not produce enough insulin in order to help regulate the amount of blood glucose in your system, and therefore can lead to some problems such as hypertension. We can also have the condition of kidney, also known as renal failure, can also lead to hypertension, and also vascular problems, so something that's wrong with one of those 5 blood vessels that we discussed before. All right, what can you, even though you're young, do right now to help maintain normal blood pressure? And so this is brought to you by the American Heart Association, the AHA, and so an authoritative source on this. What you need to do on a fairly regular basis, make sure that you know what your numbers are. And so the AMA recommends, or the AHA, recommends that your high blood pressure, you want to stay below 140/90. So remember, the top number is the systolic blood pressure, the bottom number is the diastolic blood pressure, and again, these are both measured in millimeters of mercury as the pressure units. Make a plan, make a few lifestyle changes, and so little things can oftentimes lead to very large effects. As we saw before, if you are overweight or obese, then you want to maybe try to lose some weight, try to eat a little bit healthier, try to have a variety of things in your diet, such as fruits and vegetables and some lean protein. Try to reduce the amount of sodium that you intake on a day. Americans, in general, take in way too much salt and therefore take in way too much sodium. If you have a buildup of sodium, that can also lead to hypertension, which can lead to problems with controlling your blood pressure. Try to get active, and so try to maybe work out a few times a week. And hopefully, I don't have to remind anybody here that you should limit your alcohol, because why are you drinking in the first place? You're underage, so obviously try to not do that. This is obviously geared toward adults, but obviously don't try to take in too much alcohol, which you shouldn't anyways, right? Okay. Also, keep check of your blood pressure at home. You can, for example, go to Target or to Walgreens. You can buy a blood pressure monitor, and so you put this around your bicep up here. You hit the start button. It'll start to get tighter. It'll get around you, and eventually it will release, and it'll tell you what those two numbers are, the systolic over the diastolic number. And if you need to, take medication as prescribed. And so if you keep these few things in mind, you will be able to control your blood pressure, and you will definitely be grateful of that in your later years. And so with that, we are now done with our discussion on the cardiovascular system. Next week, we'll go ahead and we'll review for the test. I hope you guys all have a nice Easter. I hope that you all stay healthy, and I hope to see you all soon. Thank you.